Listen to Alfred.
The Abbey View Medical Centre is pioneering community initiatives not normally found in GP practices. I called in on Wednesday and heard how a new choir, an LGBT group, affordable food store and an electric tricycle could all reduce demand for doctors' time. The Abbey View Medical Centre launched their Health Champions initiative back in October. The first aspect of the project that Tuesday visitors to the health centre might notice was the free cuppa, cake and a chance to chat with volunteers. That special welcome's now been extended to Thursdays. Groups to support people with identified medical conditions have also been set up.
Between 40 and 50% of patients that we see, the GPs aren't actually changing anything clinically for them. We're not managing their conditions.
That's managing partner Jane Dawes. We chatted at Wednesday's buffet reception held upstairs at the health centre. Visiting health experts, practice staff and patient groups came together to informally discuss why the health centre's gone down this seemingly unusual route. Jane introduced me to visiting health expert Martin Fisher, whom she described as inspirational. The Health Champions project's been encouraged as part of a radical rethink promoted by the NHS's Altogether Better initiative, and Martin has worked with that project for a decade.
So we thought we'd try and work with practices to change how they saw the world, which would then change how they organise, that would then change both the working life of those in the practice and, as importantly, if not more importantly, the outcomes for citizens.
Martin stressed the importance of bringing together patients who face the same health challenges.
So lots of people who are feeling socially lonely, isolated, low, turn up at general practice even though there's nothing wrong with them, because it's one of the few places that they get seen as a human being. So both of those lead to massive over-attendance at a general practice. So by meeting people's needs, this is not valuing. Needing social support, all of us need it. You cannot live a life alone. If you're isolated, living in a cave as a hermit, you have no life whatsoever. So, and general practice has no stigma. Rich people, poor people come to it, all sorts of ages, all sorts of diversity. So if you can connect people and rebuild up in partnership with the practice, that's the key bit, is not the practice subcontract now, this is partnership. It changes what the practice pays attention to, it changes the working pressure on the practice, and the people on the list, their lives get meaningful, connected, their needs get met.
Opening up the Abbey View Medical Centre to patient groups has required a change in mindset amongst the staff, but Jane says the GPs are on board. Enthusiastic volunteers have come up with several new ideas. Jane says an additional member of staff has been recruited to oversee, manage and launch these new projects. The ideas have added to staff workload, but Jane hopes that the groups will eventually stand alone. She offers the Walking for Health group as a successful example.
If you invest in this type of work, it will reduce the demand on the practice. That you can reduce your demand by 30% if you do this work. And what that will mean is it will free us up to actually our doctors and our nurse practitioners and paramedics will be able to spend time, longer appointments for people who have got complex health conditions, rather than the usual sort of 10 minutes that we're all used to.
Jane says that people with similar health issues are better able to support other patients because they get it.
We have a mindfulness and relaxation group. We've got fibromyalgia, chronic fatigue, chronic pain, support groups. We're about to set up a veterans group. We're looking at diabetes. We've got a community allotment and wildlife garden on practice land and a respiratory choir. Actually, singing is very, very good for anyone who's got a respiratory condition. It's great exercise for exercising the lungs and for improving breathing. And there's evidence to show that people who do this, actually it has really fantastic results. And again, it's not so much about the singing, it's about the social connections that you make friends, you then start going out, you start doing more, you start to feel better.
The practice hosted its first lesbian, gay, bisexual and transgender group meeting on Tuesday for similar reasons.
So our GP said it would be really helpful to set up something locally because we have lots of young trans patients who have to travel 30 or 40 miles to go and get informal and emotional support. And because of rural transport and those kind of issues, they thought it would be really helpful to set something up more locally. So we're working with Gillingham Medical Practice to set up a group that will run from Shaftesbury, Gillingham and Sturminster Newton. And it's them coming together and actually sharing their experiences is enormously helpful, enormously powerful, and it's really underrated how powerful that is.
The health benefits of perhaps the most radical new idea are obvious. The practice team is planning to launch a food store to make sure that Shaftesbury residents don't go hungry.
We have spoken to people who haven't eaten for 3 days and their children haven't eaten for 3 days. Hidden hunger is everywhere. And it's not just the quantity of food, it's also the quality.
Jane's team is planning to work with Fair Share, an organisation that redistributes surplus stock from the big supermarkets. It would be operated as a business, but all the profits would go back into the shop. This community supermarket won't just sell ambient or packeted and canned produce.
It's frozen and fresh goods as well, so fruit and vegetables, etc. People then pay a membership fee of £3.50 a week, but then can come and have £25 worth of food, but they get to choose. So it has less stigma, it's less passive, they can decide what it is they're going to have. And people often think in North Dorset that we're quite well off, but we've got lots of rural isolation, lots of rural poverty, and lots of people actually in villages who are really struggling. So we're working with the town councils, with other organisations locally to get that off the ground, and we're looking at having a mobile van as well that will eventually go around to the surrounding villages.
So that will be based in Shaftesbury?
We're not sure. We're looking at premises at the moment. So it will either be Sturminster, Shaftesbury or Gillingham. You do need quite substantial size of premises. You need parking. You need easy access for deliveries.
Jane says that users of this store, the members, won't be asked questions about their financial status. She doesn't agree with means testing.
You cut out a whole swathe of people who might actually be quite needed. So people who have been made redundant, people who are on zero contract hours, who that week haven't had any work, so therefore are struggling to eat.
Jane led the party downstairs. A red hooded rickshaw was parked outside the health centre. This tricycle will operate in Sturminster Newton. A retiring GP donated for its purchase for use specifically in that town. But Jane's team is fundraising for Shaftesbury to have its own set of wheels. She demonstrated the bike's ease of use and its rather wide turning circle as she pedalled 2 passengers around the health centre car park.
So it's an electric bike, and quite a powerful electric bike. I'm not sure it will cope with Gold Hill. I cycled it this morning around Shaftesbury without the electric, and it's perfectly reasonable. So it'll cope with normal hills and things.
Jane says the bike will bring several benefits.
We have lots of patients at 3 o'clock in the afternoon who really struggle to get home with a taxi because they're taking children to and from school. So actually we will be able to use it to actually give patients a lift if they need that.
But the tricycle will also offer a fun experience.
It's just about joy and offering a ride out to people who, through either mobility issues, old age, or a learning disability, or anyone really who can't anymore ride a bike, you can give people a lift, they can get the wind in their hair. That's the whole sort of concept. It's called cycling without age.
Jane says she'll soon start recruiting volunteer cyclists and they'll be offered some training. The broadcaster and health service commentator Roy Lilly was one of the 2 passengers who sat on the tricycle's front seat as Jane pedalled from behind. Roy has served on NHS trust boards and his articles have been featured in most of the broadsheet newspapers.
So I'd heard about it and I thought, well, I'll come and have a look, and I have to say that it's absolutely fulfilled all my wildest expectations. It's mad here. I mean, it's like there's a community centre and somewhere buried in the middle of it there's a GP practice. That's almost it's become almost the irrelevant bit.
It's too early to see if these projects do reduce the waiting time for non-urgent appointments, but Jane says staff have already observed some encouraging changes.
We've only been going for 5 months. I used to be called down every single day, at least once, if not twice, to go and see patients who were causing problems downstairs at reception and were complaining and quite aggressive. I haven't been called down in the last 5 months since we've been doing this, and we put that down to there's a different atmosphere. People are seeing that, they're feeling better about the practice. We have our urgent care team who will always see anyone who feels that they need to be seen or spoken to that day. Waiting times are getting less and less as we go on.
And Roy says he's been inspired to spread the word about what he's seen in Shaftesbury.
I write a regular column. It's called NHS Managers. I'm fortunate. I've got a an audience in a week of over 300,000 people who read me. So this, you can rest assured, will be featuring in one of my columns. And wherever I speak at conferences, the topic is always about primary care and what new innovations are. So yes, I'm a disciple and an evangelist.
Listen to Alfred